y'all. Thank y'all for having me. I really appreciate it. Y'all see and hear me okay? I want to say thank you to the DSA. I want to say thank you to the candidates. I want to say thank you to Nick for putting this together. I want to say thank you to LT. But I want to say thank you to Dawn, most importantly, because Dawn was the most honest person here, right? This is not a discussion. This is not a discussion about policies. This is a determination of who gets to live and who gets to die. Right? If your politics are dry and boring, if they're about conversations, that means one thing. It means that you're not the person who's at stake. There's this fantasy that we can talk about dreams and hopes and policies and papers, and you certainly can if you're not the one who's going to suffer when that policy fails. If you have the luxury of time, if you have the luxury of norms, if you have the luxury of bipartisan discussion, then yours is not the body that will be nailed to the cross. In Memphis, Tennessee, they dumped nuclear waste in the backyard of high-rises, big townhouses, big housing projects full of black people. Natal mortality there was 20 per thousand. That is 7 times higher than any place else in the EU. In Tennessee, there was a fight to determine whether or not disabled people deserved home health, whether they deserved it just because they had disabilities or whether they needed to be porn. Families were ripped apart. People had to get divorced. There was a process by people would lose their homes, lose everything they had behind them and move to Colorado in the hopes they would get home health on Medicaid there. 8 people killed themselves on the Capitol steps in Tennessee. Right? So we are not talking about healthcare here. Healthcare is not enough. Our goal is not healthcare alone, but emancipation. We must put the people who have been most harmed at the front of the line. And we all must walk together every goddamn step of the way. We cannot compromise until everybody has been liberated. Sorry I got worked up. It really gets my goat. My name is Timothy Faust. I'm a member of Democratic Socialists of America. For the past year, I've been driving around the U.S. talking to people about health inequity, right? Driving all over the coast, or coast to coast, plains to Gulf, talking to folks about healthcare and healthcare inequity. I don't think we're doing Q&A, but I'm happy to A any Qs after this talk if y'all will do me a favor and A my big Q, which is that I need to understand health injustice from the ground up, right? Because it's different from place to place. So listen in a minute. And so your stories and your anecdotes and your testimonials are real important. Also, before I get into my speech, a little bit of a disclosure. I am currently employed, ironically, in the insurance industry. Obviously, as you can tell by now, nothing I say represents them or vice versa. I just can't quit my job because I need the insurance. And that's not a joke. I pay $2,000 a month for medicine. And so I said earlier that I want your stories, right? And that's because healthcare is local. Health disparity is local. There is a world of difference between health needs in North Brooklyn and South Brooklyn, or Boston and Birmingham, or Los Angeles and Little Rock, or Boise, Bozeman, and Butte. And so I wanted to know more. And I've traveled up and down America to understand health inequity on the ground, to understand not just from papers, but with my eyes and with my heart, how healthcare needs manifest. And ultimately, through it all, I've just seen so much suffering. Right? I've been welcomed into families thrust into inescapable debt because of the complications from pregnancy. And I've met the children whose birth caused that debt, right? The children who are born into that debt and who will carry it all of their life. I've sat with widows and widowers, people who watched those whom they love writhe in agony and whom out of love spent everything they had in an attempt to ameliorate that agony, and who failed, and who were failed, and who carry themselves now both in heartbreak and poverty. And I've met folks who are just born into bodies that suffer, right? And I've wept with them as they share with me the constant dehumanization forced upon them, whose daily existence is a constant and blaring reminder that they're just not wanted, and who are forced to make an occupation out of begging over and over again for help. And I visited the wealthy hospital campuses, and the wealthy hospital patients, the virtual islands in the middle of their cities. And I visited the neighborhoods around them, right, mostly black or brown neighborhoods that are systematically drained of capital and labor in a dance reminiscent of colonialism, people who too poor for the hospital, in fact made poor by the hospital, suffer and die much, much sooner than people of wealthier neighborhoods even a few miles away. And I visited rural towns and rural counties, towns that see few doctors and fewer hospitals, where people leave and nobody can afford to come back, where people watch the things they love slip from them, and where a car accident far away from an ER usually means death. And over time, like all of us, I've felt my own body betray me, right? I've paced miles and miles around my city block, fearing the decay of my own temporary able-bodiedness in the wave of punishments for the sin of being sick, in which I, like many of us, am going to drown. And so here are the contours of the world American health finance has given us. 1, America spends more than any other country on healthcare, almost twice as much per capita as the next biggest spender, but cares little to nothing about community health, cares little to nothing about population health, cares nothing about that which cannot be packaged and sold. 2, 75% of our spending goes to treat chronic conditions that are preventable, yet nobody footing the bills has really tried to prevent them. And 3, our system of for-profit private insurers literally takes money from poor people and gives it to the wealthy. It is negatively redistributive. In 2014, it pushed 20 million people into poverty, or from poverty into extreme poverty. And now, I can't give you a quick fix, right, because there is none. There is no technical magic by which we destroy this hateful machine, but I hope I can offer you a vision, right, an aspiration, an understanding of the tools by which we together build that better world. So if you permit me, I want to talk about 3 things: what we have, what we want, and what comes next. I want to talk about the overwhelming and numbing brutality of for-profit healthcare. I want to talk about the relatively benign structural changes that we demand instead. And then I want to talk about something bigger, which is a moral compulsion, right? That broader vision of the better world, this idea of health justice. That sound all right? Great. I'm going to grab a thing of water. I got real mad earlier. Woof. I want to start off by confirming something that you already feel in your bones, that you already know pretty intimately, which is that you are being made to suffer. You are being exploited. And because fundamentally we have created a world in which you are made sick and then punished for being sick so that somebody else can turn a big profit. Let's talk about why that exists. By and large, the costs of receiving healthcare are much, much more than any individual person can afford by themselves. Not a lot of folks need healthcare in a given year. In a given year, 50% of all medical costs come from 5% of the population. 80% of all medical costs come from 20% of the population. That's a fungible population, right? It moves around. Maybe some years you get into a car accident, other years you don't. Some years you give birth, other years you don't. So these costs bounce around from person to person, but when they hit you, they can hit you pretty hard. And if everybody had to pay all of their own healthcare costs out of pocket, eventually millions and millions of people would go into crushing bankruptcy or medical poverty. It's not a guess, that's history, because out-of-pocket spending used to be the only way we paid for healthcare. And it wasn't until a bunch of nurses and a bunch of unionists and a bunch of socialists insisted that letting folks go into poverty because of illness was immoral that we shifted to a new payer model, and that's the idea of insurance. Now, insurers are organizations, or in the US, companies that receive revenue by charging you monthly premiums. When someone gets sick, insurers spend the money they take from everybody to pay off a portion of those healthcare costs, plus keep a profit for themselves. And so the more revenue an insurer receives from customers, or realistically, the more subsidy it receives from public money, the wider those costs are spread, and the lower the insurer's per person costs. This idea is called a risk pool. But here's the real dumb thing, right? Because if people use their insurance plans, the insurer loses money. So if an insurer has too many folks who use their insurance plans, or too few healthy people, or too many sick people, for example, if it gets one or just one unexpected person who has hemophilia, whose care can cost up to $1 million a year, its per person costs really skyrocket. And so to compensate, it increases premiums. But when premiums go up, people that can't afford them drop out, unless of course they're sick, and they can't afford not to afford them. They stay on board, so costs keep going up, so premiums keep going up. It's this big vicious cycle, this big Ouroboros of misery, right? So what an insurer wants is as large and as uneventful a risk pool as possible. Or wants to find ways to kick out sick customers, or coerce them into leaving. Maybe it drops coverage for the drugs that sick people need. Maybe it cuts off access to the providers who treat the sickest patients. It turns out that because insurance companies lose money when you get sick, the task of an insurance company is then, as much as it can, to make sick people somebody else's problem. It's silly. We've just been tricked into viewing healthcare as a transaction instead of a relationship between a person, their body, their neighborhood, and their doctors. That's perverted. We've mistaken the profit motives of corporations for healthcare. And over time, we've delegated the responsibility of providing insurance to employers, let's post, because that results in a status quo of total employer domination, in which your access to things like contraception, or blood transfusions, or hormone therapies are determined by the whims of your employer. But if you aren't lucky enough to have an employer, or if you've got an employer and your employer's an asshole, you're just left behind. And so the people who profit from the commodification of our bodies have decided it is acceptable to shackle the well-being of children to whether or not their parents were lucky enough to have gone back in time 40 years, learned the code, and found a benevolent employer. Welcome to the hell world of America, 2018. Now it gets worse, right? It's too early in the talk for things not to get worse, because the costs of healthcare keep increasing. And they increase much, much faster than inflation. Part of this is because more people are living longer with chronic conditions, right? Things like heart attacks or trauma or diabetes aren't the death sentences they were even 2 or 3 generations ago. So we spend more money taking care of more people longer, which is a fantastic way to spend money. But that's not what's at the root of the problem. You know this. Most of these cost increases occur because hospital CEOs, pharmaceutical companies, equipment manufacturers, close personal friend Martin Shkreli, keep finding more and more ways to charge more and more money for the same services, or racking up fees for unnecessary services, and no private insurer can really stop them. Here's what shakes out. In the US, the average inpatient procedure costs 40% more than the same procedure when performed in France, performed on the same patient. Or take, y'all know MRIs? MRIs are just big fancy computers that print money. And in the US, an MRI scan costs 5 times more than an MRI machine doing the same MRI scan when performed in Australia. The costs are high because the prices are high. Or most egregiously, think of the relationship between primary care and hospitals. Primary care is the things like checkups, basic medications, the kind of familiar health care you get from your family physician. It's high volume, it's low margin, and generally it's not super profitable. But now conversely, a hospital gets paid an average of $2,000 a night for an inpatient stay. So if you're a hospital CEO, it just makes a hell of a lot more sense to push folks into inpatient admission instead of wasting your time or wasting your money letting them get cheap primary care outside the hospital. Or it makes even more sense to buy up all the cheap primary care clinics and then using them to charge hospital rates. Now that sucks. And it means that 1 in 6 Americans have no access to primary care at all. So as you can see, there are kind of 2 fundamental truths to American healthcare. One, if you're a payer, like an insurance company, it's just not profitable to insure people who are sick. 2, if you're a provider like a hospital CEO, it's extremely profitable to charge sick people as much as possible, as late as possible, so long as somebody's footing the bill. And so upon these jagged rocks, we've built this big, loathsome church of American healthcare, in which the question of who gets to receive healthcare and when, or really, whose suffering matters, is determined by private profitability. Well, this whole scenario scares the bejesus out of everybody involved, particularly insurers, right? Insurers are interested in finding ways to avoid paying these rising costs. Sometimes that means just refusing to pay for claims. It certainly happened to you or someone you love. Before the ACA admitted that insurers would just refuse to cover people who were likely to be expensive. You know the phrase pre-existing conditions. But it's still not enough to claw costs down. So we all got together, everybody in America, back in the 1970s, which I certainly remember, and invented the idea of consumer-driven healthcare. That's the idea you should make consumers, which is just a libertarian way of saying people, pay more for the costs of their own healthcare, right? Because that's why your deductibles and your co-pays and your premiums go up every single year. Because once you're paying more for your own healthcare, you'll be turned somehow into a smart shopper. And through the power of the free market or whatever, you'll shop around, not get unnecessary or too expensive care. You'll find the cheapest ED in town if you get hit by a car. You'll Yelp your surgeon. And somehow all of this together will bring costs down. Now we've just internalized the language of the oppressor, right? Because insurance companies can't afford the rising costs of healthcare. Their brilliant solution is to force more and more of those costs onto us. That's why right now, the average silver plan, high deductible plan, has a deductible of $2,700, and 40% of Americans have less than $400 in savings. You know what's worse than that? This whole thing doesn't even work, because no, people who are forced to pay for healthcare costs they can't afford just don't seek healthcare. And they don't not seek expensive healthcare. They don't seek any healthcare at all. They avoid primary care. They avoid preventive care. They ignore that rash, or try not to look at that tumor, or take away that chest pain. Because we demand people bear the burden of healthcare costs they can't afford, they are forced to just watch their bodies turn to time bombs until they have a heart attack at their jobs and leave their kids behind. This is awful. What do you do about it? How do you square the rampant increase of healthcare costs with the fact that it's just not profitable to insure sick people? Well, if you're the Democrats, you can collaborate with the Heritage Foundation to offer us the Affordable Care Act, which is at its core the massive subsidization of private industry with public money. The ACA is a big bargain, right? A big plaintive whale. Please, 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 how many billions of dollars, it asks, do we gotta give you so you stop kicking sick people off their insurance plans? No, the ACA, of course, had its successes, first and foremost among them, the expansion of Medicaid. Where Medicaid was expanded, we saw a 6.1% reduction in the mortality rate. That's 11.1% among communities of color. And we understand why. These are folks that have been systematically, if not violently, denied access to health care in the first place. So even the relatively meager expansion of Medicaid does a hell of a lot to help them seek care when they need it. But at the end of the day, it's not enough. Because costs keep increasing. Quality of care stagnates, if not worsens, for the most vulnerable among us, and 31 million people are still uninsured. The ACA has failed in its pursuit of health justice. And there are consequences for this failure. There are grave consequences. Because among so-called developed countries, it is America that is the most dangerous place to be sick. Among peer countries, America is the most dangerous place to be black. Black infants die at twice the rate of white infants. America is the most dangerous place to be pregnant, with the highest maternal mortality rate of any first world country, of which 60% can be prevented by taking the person's blood pressure. America is the most dangerous place to be a child, the most dangerous place to be a woman, the most dangerous place to be gay, the most dangerous place to be old, and one of the most dangerous places to be disabled. Last year, life expectancy at birth fell for the first time in almost 30 years by 1/10 of a year. And there were 4 million people born last year, and so that's a theft of 400,000 years. But a funny thing happens when you look at this data more closely. You understand exactly what I'm going to say. It is woven into the American fabric. When you look at this data more closely, you understand all this danger only exists if you're poor. Because rich people get to be exempted. They have exempted themselves from all these problems. Men born in the wealthiest fifth of Americans get to live 15 years longer than men born in the poorest fifth. Among women, that gap is 10 years. America has made a choice. America has refused to recognize the essential dignity of being human. And in this refusal, it has caused mass suffering. And this is an act of war. This is the terrible secret of American healthcare. This is the fundamental American illness. They are killing us and robbing our corpses to foot the bill. And now this big, stupid, multi-payer, profit-driven Rube Goldberg machine of American healthcare is failing us today, and left unchecked, it will collapse tomorrow. That is incontrovertible. It will collapse. So we demand something different. We demand a federal, universal, single payer. Now, single payer is a pretty simple concept, right? Instead of having a bunch of private insurers with a bunch of fragmented customer bases, each seeking to avoid taking care of unprofitable sick people and pass the buck, we have one publicly owned and publicly funded insurer, a single payer with a legislated mandate to cover in full all care for all people. Now, the phrase all care for all people is important, right? We don't want Medicare as it exists today, because it has private carve-outs, it has cost sharing, it has out-of-pocket. Oh, no, we want an improved Medicare for all people in America that guarantees comprehensive coverage, including medical, vision, dental, and long-term care for everybody in America, including non-citizens, that is free at the point of service with no cost share. No longer will somebody needing help be bound by Byzantine provider networks, right? No longer must you choose between food and medicine. No longer will your care be dictated by who your insurer is, because the insurer is Medicare. Everybody benefits when accessing care is free and easy, right? Delivering care, being a doctor, being a nurse, being a social worker, that's complicated. Bodies are big bags of unknowable goo, and they hurt all the time, and making them hurt less is a difficult process. But paying for it isn't. Paying for it's pretty simple. People ask, how can we afford to pay for this thing? The answer is, we're already paying for it. We're just forced to spend that money really, really stupidly. Right now, American public money pays for 2/3 of all healthcare costs in the U.S. A little less than half of that 2/3 is actual Medicare, Medicaid, and VA spending. The remainder is government subsidies to private companies. You are literally subsidizing your own employers. The remaining third is out-of-pocket costs, an additional kind of private tax you pay to insurance companies and hospitals in the form of premiums, deductibles, and copays. America is already spending the money required to fund single payer. It's just that the insurance industry is incompetent and inadequate and unable to pay its fair share, so it passes the costs back to you. That's a hell of a scam. We know, and we have known for decades, that rising costs come from rising prices, not from improper hospital use or whatever. But since that doesn't help the insurance industry make a profit, they just ignore us and stick us with the bill, and then hold our mediocre insurance plans hostage for government subsidy. It's all a giant fraud perpetrated on the American people. And we already know how to use a single payer to halt rising prices. Price negotiation with a weight of 300 million people behind it. What's more than that, we know that once we cut out the administrative costs and profit-seeking in the private insurance market, we free up, in a very conservative estimate, an additional $370 billion a year. That's a big chunk of change. What do we do with it? We use it to improve everybody's standard of living. We build or reopen primary care clinics in rural areas. We fund community health centers in poor neighborhoods. And most importantly, we return the money to the people who do the work. Take, for example, you all know home health aides? Or a sick parent, sick friend, sick kid. A person can receive care in the hospital, but again, that's about $2,000 a night, if not more. That's a lot of money. Oftentimes, a person who needs less critical care can receive it at home. For a lot of people, not everybody, for a lot of people, home is a nicer place to be, right? Homes where your TV lives, homes where the computer lives, homes where your dog lives. Great. And so you can receive care at an average of $120 a visit. Amazing. Everybody wins. You save money, more humane care. Everybody comes out on top. Everybody comes out on top, of course, except for the home health aides themselves. Because for this valuable labor, they're paid a nationwide average of $11 an hour. I think much lower in Idaho. So we can allocate this money to do what the private market refuses to do. Pay fair wages for essential care that helps everybody. Well, think about it, right? Who makes a real difference in health outcomes? Is it millionaire CEOs? Is it expensive luxury suites and expensive luxury hospital wards? Is it $40,000 data packages for nerds? No, of course not. They just get to bill the most. But it turns out that non-diagnostic, extra-clinical care, compassionate labor makes all the difference. Social workers, patient advocates, nurses, these are folks who are chronically unrecognized and undervalued, but they're the only folks, the primary folks, who make a difference in population health. These are pretty basic ideas. These are pretty simple demands. We understand the social forces that make folks healthy, and we understand the structural ones that make people sick. And in the face of this knowledge that population health is structural and social, knowledge we've had for literal decades, capitalism's response is to blame illness on aggregates of atomized individual choices, right? And then package them into healthy lifestyle commodities, on apps and cookbooks and step trackers. But despite what app companies insist, there are no apps that bring about better health. A How to Survive on $4 a Meal cookbook doesn't do anything for folks who only have $4, if that, per meal. A program that penalizes you for going to the ED at the wrong time doesn't do shit to make you healthier outside the hospital. But in the multi-payer private model, nobody's investing in population health. Nobody's investing in compassionate labor. Nobody's paying these people fairly. And they never will. Because right now, your private insurer only bears the costs of you receiving care while they're insured. Because you're going to change insurers in the future, and eventually, God permitting, go on Medicare, they don't feel any pressure to provide you with care that makes you healthier now or helps you become healthier in the future. Let me put it another way. You know that if you're at home and the window breaks, the weather gets in. And if the weather gets in, you get sick. And if you get sick, or if your kid gets sick, you got to go to the doctor. And if the local clinic was shut down or it's booked solid, you got to go to the hospital. And if the hospital's far away or you don't have a car, you got to spend all day, if you're lucky, taking the bus. And if you got to take the bus, you got to spend all day dealing with the bus system. And if you got to spend all day figuring out the bus, you can't go to work. And if you can't go to work, you can't afford to fix the window that caused the problem in the first place. And so the answer isn't to fork over a pile of cash every single time you go to the hospital. The answer begins with giving people what they need to fix the damn window. But there are no private actors in the American model who will consider responsibility for these things on their own. Aetna is incapable of addressing the foundational problems of healthcare, of fixing the broken windows. Anthem is incapable of reopening the 18 rural hospitals that have closed in Texas because of lack of Medicaid funds. Humana is incapable of rupturing or of repairing the ruptured PVC septic systems in South Carolina that have brought hookworm into the state. In the exact same way that a billionaire, even a good billionaire, is incapable of lessening income inequality. Or a cop is incapable of shrinking the prison industrial complex. They cannot fix these problems because they've been constructed by and within these problems. And they cannot solve them because they existentially cannot think of them as problems in the first place. But we can, and we do. And so it makes perfect sense that the same actor who suffers when people don't get care, which is all of us, united against suffering, should be the actor that pays for that care in the first place. Because once we force the federal actor to bear the costs of providing care, and the risks and costs of what happens when care is not provided, once we force it to confront the rampant suffering of all its people, it can finally be used as a tool for realizing health justice. If your people are suffering because they don't have a place to live, or where they live is unsafe, then housing is health care. And you must build housing, social housing, to bring health care costs down. If your people are suffering because they don't have access to healthy food to eat, and so they're getting diabetes or comorbidities like cardiac failure, then food is health care. And you must provide people with affordable and free food options and the time, space, and materials with which to prepare. That's how you bring health care costs down. If people are suffering because they don't have access to needle exchange programs, therapy, or counseling, then rehabilitation is health care. And not our current end-of-life palliative care model of rehabilitation, but the full social and safety structures required to help people handle addiction, or perhaps not fall prey to it in the first place. That's how you bring health care costs down. Because single payer is wonderful, but single payer is not the goal. Single payer cannot be the goal. Single payer is a tool. Health equity, health justice is the goal. And when we fight for health justice, we all fight side by side, because economic justice is health justice. Environmental justice is health justice. Reproductive justice for those who don't want to reproduce and those who do, that's health justice. And justice for black lives, justice for brown lives, justice for native lives, justice for trans lives, justice for the lives of immigrants, justice for people in prison, and the well-being of all people, regardless of age, gender, race, or creed, that is health justice. We have inherited a world in which your permission to receive health care, capital's allowance, you can be safe in your own goddamn body, is dependent upon how much a corporation can extract a profit from you. And thus we have permitted in our country utter desolation. Without our consent, we've been forced to participate in the condemnation, criminalization, and abandonment of people in need. People with disabilities got to spend tens of hours a week pleading with insurance companies for a chance to maybe go on a waiting list to receive the bare minimum of care required to keep them alive, if they're lucky. The unlucky ones got to plead with Medicaid or Social Security to maybe consider compensating their partners, friends, or parents a whopping $1,000 a month for taking care of them full time. Elsewhere, we have the opioid epidemic. An epidemic whose vector is capitalism itself, originally designed as a patent extension ploy with a massive marketing campaign, which now kills 180 people a day. And those it doesn't kill are written off as criminals, right? Because only criminals use needle drugs. Who cares about them? They're made untouchable, left to rot while their children cry their names. People who have chronic pain are just pushed to the side, stigmatized, and ignored. In life, it is poor and uninsured people who are used to test the drugs that are then turned around and sold to the wealthy and insured. And this servitude continues in death because it is primarily the organs of the poor that are ripped and sold to the wealthy as transplants. There is no end to the body war of capitalism. There is no line too far for the commodification of the body. America has cheered the privatized slashing and burning of social structures and then has the audacity to punish people for suffering. When people are in need, we waste time, effort, and money means testing them, separating the so-called worthy from the unworthy among those who need help, and then stigmatizing them instead of guaranteeing the basic decency of health equity. Now, this is cyclical. This has happened forever. It will continue to happen so long as we tolerate, even in whispers, the idea that the body is a commodity. And for systematically marginalized people, sick people, homeless people, people battling addiction, people with disabilities, poor people, pregnant people, trans people, women, people of color? Well, when there's no way for the medical industrial complex to find value in their bodies, this is America, and there's always the private prison system ready to receive them for profit. So my friends, healthcare is not enough, right? Our fight must be for something much greater than just insurance. We've been made sick by structural poverty and structural racism. We've been bitten by the wicked snakes of racial and economic and patriarchal domination. And these are not problems that insurance can solve. And so when we attack, we got to aim for the heart. Capitalist exploitation. And so single payer is not the revolution. It is just our first counterattack in a war that is already waged against us, by which subsequent counterattacks are made possible. We got to think about our history, right? For the past 100 years, every single time the insiders, right? The well-meaning senators, the well-meaning policy writers, the well-meaning candidates, the well-meaning union or nonprofit leaders, every single time they've taken on the insurance industry, they've been beaten by a reactionary establishment that can outmaneuver, outfund, outfox, and outgun health reform. They lost in the 40s, they lost in the 60s, they lost in the 70s, they lost 3 times in the 90s, and they've lost in the 2000s. But when these people lose, when these nice, well-meaning people lose, they're not the ones that suffer. It's not the senators or the union leaders, the policy nerds who find their suffering compounded. No, it's the people in Section 8 housing. It's the people in prison. People whose backyards are dumping grounds for toxic waste. It's people with disabilities, the poor mothers and their poor children. People who have been denied work, care, or dignity. And so we have an obligation, right? We just can't lose again. We stand on the shoulders of hundreds of thousands of nurses, of tens of thousands of doctors, and the legacy of grassroots movements like ADAPT and ACT UP, and we must build the massive popular movement which not only demands a single payer in our government, but which demands health justice in our nation. We must bring to the front our neighbors and friends who have been immiserated, who have been made to suffer most cruelly, and we must demand that these crowns of thorns thrust down upon their heads are lifted. We cannot rest until all people are liberated from the suffering inflicted upon them. But there's good news. We know it works. We have an obligation to ourselves and to those who we love, now and in the future, to be good neighbors, to be good socialists. We've got to extend the basic decency of showing up, going to folks around us, listening, asking questions, finding common ground, listening again, and putting our shoulders to the wheel. We must identify what battles we can win, and then win them. We must provide material relief for people around us who are suffering now. We must fight in our home for a continuous spectrum of demands aimed towards health justice. And unlike liberal policy tweak incrementalism, our successes must offer material and redistributive reforms. Well, the ways this is happening around the U.S. are many, right? Just a couple. In SF, City of San Francisco, DSA SF fought for and won Prop F, guaranteed right to public representation if you're evicted from your home. In Cincinnati, 8 socialists won a needle exchange, the first in the region. Back home in Texas, the progressive bastion of Texas, the paid sick movement in San Antonio turned out 144,000 people. Now, for comparison, 99,000 people voted for mayor in the last election. This is the largest popular movement in San Antonio in years, if not decades. But most interestingly, I think, absolutely the most exciting popular movement for healthcare in America right now, and I'm not blowing smoke up your ass, is the movement for Medicaid Expansion in Idaho. Right, we talked about earlier how Medicaid literally saves the lives of folks who have no insurance, but it goes much deeper than that, right? The governor of Idaho and the ledge of Idaho didn't choose not to expand Medicaid out of ignorance or because the far right was too strong for them. It wasn't a lack of facts and figures or rational discourse and debate that drove this choice. That wasn't even a financial motive, right? Because Medicaid expansion in 2013 was entirely federally funded, and now it's a 90-10 federal match program. No, the choice not to expand Medicaid wasn't made from reason nor debate, but out of domination. It was made as a continuation of the belief that people who are poor, people who are sick, people who are suffering are just unimportant, undesirable, and should be marginalized as definitively as possible. And so I'm not interested in facts or figures, right? In making dry arguments for Medicaid expansion or dry arguments for single payer. Why cede that ground to the folks who have conspired to deny us the safety of our own health? And I don't know what the revolution looks like, but I know it's going to require massive mobilization, like what we see in San Antonio, what we saw in SF, what we're seeing now in Idaho, and I hope to sweet God we will see on Tuesday for Prop 2. This is a nationally historic event. I wouldn't be here if it weren't, right? And so I'm asking you very tenderly and very piously that if you have the time, if you have the ability, if you have the energy, please help all in America who have been made to suffer by helping here first. Because what we're going to learn on Tuesday, I hope, is that if we give people something material, they will fight to get it and they will fight to keep it. If we fight with people today, they will fight with us tomorrow. We build solidarity not for fun, but as a function of building power. And our job is not to build a popular movement. Our job is to stitch together a popular movement, a big, messy quilt of movements aimed toward health justice, spanning the country from coast to coast and plains to gulf. And I believe that if the Idaho Medicaid expansion is successful, it will become the model for health equity work in America for the next decade. And through this massive mobilization, and only through this massive mobilization, what we will see in Idaho on Tuesday, the movement for health equity we'll see across the country, this is a fight we will win. I mean, hell, the numbers are in our favor, right? 70% of people prefer Medicare for all nationwide. This is not a radical proposition among the folks it affects. We're simply discussing a basic principle of fairness. You know this. We all know this. We all know we're fashioned from a formless and shapeless place. We've all been thrust through the maw and born into a world that is arbitrary and unequal in its allocation of suffering. And yet, instead of affording each other the basic dignities of being human, we've developed this bizarre model of American health, American well-being, in which one's suffering is one's own responsibility, in which empathy is unnecessary, vestigial. We have atomized suffering, and in turn, assigned blame for suffering to those who suffer. And you've seen it. You've seen it in your homes. You've seen it in your country around you. We've all seen such naked suffering inflicted in our name. I've seen, you've seen, families ripped apart by the unrepentant, unyielding bloodlust of capitalism. We've all seen people torn limb from limb in the service of finding profit. We've seen the dehumanizing machine all at once and felt despair. For me, it is often heinous to be an American, to be complicit through my simple existence in my only and horrible home, the home I love so much, which is so cruel to so many, to be complicit in the mass immiseration and annihilation of those against whom the whole rotten weight of the world has been stacked. And this is intolerable to me. I believe it is intolerable to you. And so we say, enough. Not in my name may this America persist. May we rid ourselves not in fear, but in love. And from that love, may we cultivate the specific fury by which this cruel machine can be destroyed. Love for those who suffer around us. My friends, single payer is moral. Single payer is necessary. And single payer is achievable. Thank you for having me. Solidarity now, solidarity forever.